Good morning, dear friends. Good time of the day, wherever you are. Thank you for being with us today on our Health Wave podcast. Today, we will be talking about food as medicine. What does it mean exactly that food is medicine? What kinds of foods are considered to be medicine or can be medicine? We will cover the future of medicine. Where is the modern medicine headed? And a lot of other different things, health tips for daily living. We will talk about farmers markets and CSAs and natural products. So we have several special guests with us today. We have Dr. Ashwani Garg, a family physician who practices lifestyle medicine, serves as volunteer medical director at Salient Lifestyle Center in Elgin, Illinois. He teaches physician assistants at North Central College. Dr. Garg, his wife, and twin boys live in northwest suburbs of Chicago. And I have to mention what makes Dr. Garg especially special is that he has been a Purple Sprout approved doctor for the past 5 years since we got to know him. And now we are happy to bring on Dr. Garg. Hello.
Hello. Thank you again for having me.
Yes, of course. Thank you so much for joining us.
Thank
So
you.
I know that you have to work today, but thank you so much for being with us this early morning. So,
Thank you.
Dr. Garg, I already had a chance to introduce you to our viewers and listeners. So, can you please tell us how did you embark on this healthy journey? It's very surprising for a doctor, and I already told our viewers that you have been a Purple Sprout approved doctor for the past 5 years. So, can you please tell us how did you embark on this journey?
Sure, thank you. So it was it's been about um actually it's been almost like 9 years, about 9 years or so that I watched the movie Forks Over Knives and also the CNN documentary. And the reason I embarked on the journey was because I myself saw patients that improved dramatically, even those that were already healthy. And then also in my own life insurance, I had a few values that were a little bit off in the lab checkup. So I did in the beginning, I did, almost raw vegan, and I followed PCRM's guideline afterwards, and I saw dramatic changes.
Beautiful, beautiful. So, you advocate for whole foods, plant-based living. Is that correct?
Yes, thank you. And I've seen many results from that.
So, how are you able to influence your patients, or are you? And if you are, what are their results?
So I was lucky to be in the first class of certifications from American College of Lifestyle Medicine. And there we learned some skills, including motivational interviewing, meaning meeting the patient where they're at and helping them move one step better. So those techniques involved interviewing them to see which stage of change they are and where they are at. And then what I found is most patients are too shocked by big changes. So then it's like pulling, not pushing, inviting them to make those changes. And one way that I like to start is for some patients is a survey. It's called 4-Leaf Survey. So it's at the number 4leafsurvey.com. And it's just a quick questionnaire to get an idea of their current status. And while they're doing that, I write down a few notes. And then the treatment plan is customized for each person. Some people are ready to make bigger changes because they have more serious health problems and they want quick results. So I will help them move to fully whole food plant-based. And then we customize it with their needs. If they have weight loss, weight gain needs, if they have high degrees of inflammation, heart disease, or cancer, then it's customized to that health condition, or diabetes as well.
Got it, got it. That's wonderful. So, what challenges do you think you are facing when you are trying to help people transition, or what challenges are those people facing?
So the biggest challenge is what I call inertia. Inertia means, so think of a big heavy object and it takes a lot of effort to move. It's that, first movement that takes the most effort because of social pressures and upbringing and culture. And then also stress and lifestyle. When someone is stressed out, it's hard for them to make changes because when someone is stressed, they go back to what they know, so-called comfort food or
Sure.
comfortable ways of doing things which they've done for many years. So the
Mhm.
hardest part is making that first step to realize the need for change. So it's almost like treating addiction, right? That people
Mhm.
are just hooked to their previous way of life. And the hardest part is realizing that you need to make the change.
Mhm. And as we know, the hardest thing, or the hardest person to change is yourself, right?
Right.
So,
Exactly.
so what benefits have you seen people experience once they make a full transition to whole foods, plant-based living, or partially, or becoming
Sure.
plant-rich?
Yeah. So I would say this, that generally people see big benefits when they transition to mostly plant foods, and that can be, roughly 75 to 95%. But sometimes that extra 25 to 25% can make the biggest difference. So they already made health changes, they see themselves improving. That's why many of them want to go to 100% plant based. And
Mhm.
so I've seen, diseases reverse. And the fact is, it's not just me, it's well reported in the literature. There's two journals, American Journal of Lifestyle Medicine and the International Journal of Disease Reversal and Prevention. The good thing is that second journal is available in a consumer form, which is easy to read and it explains all the research. And then there's, just a wealth of knowledge published in mainstream medical journals. So, for
Mhm.
example, I like to teach physician assistants, and a recent article of the Journal of of Physician Assistants included an article on plant-based diets, which is great. So, what it is, just the last 2 years, this has become mainstreamed, and the latest research on COVID is very promising as well, showing that healthy living helps, exercise helps, plant based eating helps reduce the chance of hospitalization and death dramatically. We're talking roughly 50 to 75%, which is the biggest benefit.
Mhm. That's wonderful. My next question was going to be, how are you finding it challenging practicing what you believe within the very strict protocols of the modern medicine? But I think it's becoming less strict. Is that so?
Yeah, it is definitely becoming better. So, very interestingly, you may know Dr. Neil Barnard. He was
Of
invited
course.
to our very large health system to give a continuing education talk online that all physicians and healthcare providers were invited to. So it is becoming a lot better. And, the mainstream doctors are changing. So I know several doctors now, GI physician, pediatrician, even cardiologists that are on board with plant-based eating. So the good thing is patients who need specialty care are now able to find, and in many cases, practitioners that are on board with the plant-based approach. I even know an endocrinologist who's on board with it. So patients do need specialists. Sometimes they need procedures and surgeries. I even know a brain surgeon who is whole food plant-based, inspired by Rich Roll.
Wow. Well, that it's all music to my ears. But
Yeah,
today, one of our guests, he will be speaking about his experience and how he got to be plant-based, and he was also influenced by ritual.
that's great.
Yes, yes,
Wonderful.
it is. So, Dr. Garg, can you please tell us a little more about teaching physician assistant students, and how, if you are able to kind of influence them as well, plant the seeds of,
Sure.
understanding of what benefits plant-based living can bring?
So interestingly, in the medical education world for physicians, teaching is quite challenging if with lifestyle medicine because their curriculums are so jam packed and there's hardly any room for nutrition. In fact, it's less than, let's say 1 day's worth of teaching in most programs. And even that nutrition's focused on artificial nutrition. So, with the PAs, for example, physician assistants, I found such an open mind and a good friend that I knew from medical school. We came to each other's weddings. So she started a new program at North Central College in Naperville. And she was very open minded to the idea of incorporating lifestyle medicine when she invited me to be part time medical director. So I have started from the beginning. The first lesson I taught the PA students in my class, which is called PA Patient and Society, is empathy, because I think it's so important to learn empathy first before you teach anything. You have to connect one-on-one with the patient, show them you care. And then we did motivational interviewing exercises where they interviewed each other and implemented some interventions to make change. And the main approach is not as a parental relationship, but as a coach relationship, pulling rather than pushing, and motivating change based on the necessity of change. And what I was very impressed by is we showed Plantwise documentary, and they all had reflections to write. Plantwise documentary is a documentary about plant-based eating from Marilee Jacobs, who is the director who directed Eating You Alive. So we've been able to incorporate exercises and techniques. Each of them has a personal wellness plan, and I was happy to see that nutrition was a part of many of their wellness plans. So we have big things in store, and we hope to make a mark in the education world. And what I'm hoping is that PAs will fill those gaps where medical doctors, have left, because they have limited time, they have limited education. I hope the PAs will be the leaders in the field of lifestyle medicine, because that is the future of healthcare. We have a grand shortage of primary care doctors in the field. In fact, one prominent university in Chicago graduates fewer than 1 to 4% of their providers as family doctors. So that's how bad the situation will be, with a big demand coming up and less of a supply. That, I feel like PAs will fit just great and be able to add value to the care, not just do the same as the doctors do, but more in this field of lifestyle and motivation, because patients have a big trust of the physician assistants. They have a great relationship with them.
Well, God bless you. And I pray for more doctors like you.
Thank you.
So, where do you think modern day medicine is headed in
Yeah, I
general?
would say, the latest seems to be more pharmaceuticals, more vaccines. There's an explosion of these so-called biologic drugs, which it's hard to keep track, but they always end in the two letters AB. The AB stands for antibody. So these are generated in the lab, and they're supposed to, work miracles according to the drug companies. But often what happens is, with the vaccines, for example, the results are less than the promise. We were promised, for example, these mRNA vaccines would eradicate the virus, right? That if we got enough herd immunity, it would be gone. But what are we seeing today? We're seeing a resistant strain and 5 versions of it popping up that are now infecting people who've been double and triple vaccinated. But and as far as the antibodies, sure, they have a great promise, but they don't always work, and sometimes people, have diminished effect after a while for those. So really, the root cause, the two greatest developments in medicine today, are the understanding of microbiome and the understanding of chronic inflammation as the root cause of many diseases. For example, for heart disease, it's not just cholesterol, but inflammation. Diabetes, it's not just blood sugar, but inflammation. Cancer, related to inflammation. And then the next thing, which is what they taught me in medical school, was the field of psychoneuroimmunology, how the psyche, your soul, connects to your nervous system, which connects to your immune system, and then modulates chronic inflammation. So stress is often the most underlooked part of this disease cascade. And that's why I love lifestyle medicine. And so speaking of that, I'm very happy to do my work, in a lifestyle center, one of the first in the Illinois area.
Yes. So you're the volunteer medical director at Salient Lifestyle Center, right? A nonprofit
Yes.
community center where you help people heal from the ground up. So please tell us about that. This is very exciting.
Yeah, so this project started with conversations with a friend who's a pastor in the Adventist church, Gabrielle. And, just we were talking about what we hope to have and how healthcare, is incomplete, and how it would be great to have a partnership to teach lifestyle and health. So with that center, the Adventist church funded part of it, and thanks to a grant from Ardmore Institute of Health, we were able to start up. And so there's a teaching kitchen downstairs with a big, dining area. There's a classroom. They have tower gardens, which are hydroponic gardens. So, it's just a different approach. Not everyone agrees with that, but it's great. And then there's also an organic community garden outdoors, which they have started. Very successful last year. We grew many things. So it is all around teaching for mind, body, spirit, lifestyle, physical exercise, and kitchen. So we did a little celebration of a class we did called Creation Life, which uses parts of the gospel of Jesus Christ to teach lifestyle. And so at the end of it, we had a community kitchen demonstration, and I made what's called pumfu, which is tofu made from pumpkin seeds. And then we made a noodle ramen, and people brought dishes. This lady brought a blue corn dessert, which was fruity. It was delicious. So that's the key, is to gather people together in a community to teach lifestyle, because what I found is lifestyle taught in isolation in the exam room is incomplete. When there's a group, then it becomes complete. And Gabrielle is teaching a depression and anxiety recovery program. Can you imagine the last 2 years how it's been like? This is so timely and important for the community.
Absolutely. Wow, this is absolutely amazing what you do. So how do parishioners, how do people in the community respond to this innovative style, at the church?
Oh yeah, so the participants we have had so far absolutely loved it. Whether they're of one religion or the other, we've had people of different faiths come. And sure, of course, we teach in the context of the Bible, but we open the lessons to everyone. And people responded in a great way. They found things which they never knew about. We watched Plantwise movie together. We made veggie chili together. And so the nice thing is, we combine the health lessons with spiritual lessons and food. And the discussion part is the best, where people share with each other. So we hope to start up some Spanish language programming as well.
Wow.
And the nice thing is, this is a community center, meaning it's freely available to anyone. They may just purchase the textbook and materials, but that's all we ask, And the nice thing is, we've seen pay it forward. We've seen people give grants of their own money. We've seen people buy books for others. And that's the most amazing part. They like it so much, they're helping others.
Wow. The power of and the energy of group is always amazing. Yes.
Absolutely.
It multiplies and it grows exponentially.
Yes. And that spirituality is what's often missing from lifestyle education. For example, remember at your cafe, we invited the Bhante Sati from Minnesota to come and talk to a group. Wasn't that wonderful? So we
Yes.
talked about veganism and we talked about the medical part. So it's that model that when we combine mind, body, spiritual aspects and not shy away from it, then you see the best results in a community setting.
Absolutely. So we also believe that the body, mind, and the soul, or the spirit, they're inseparable. So, and we just love connecting medicine to the energy and the spiritual aspect of healthy living. So
Absolutely.
it's so great when it all comes together.
Yeah. Thank you.
Thank you so much, Dr. Garg. So we truly appreciate everything that you do.
Thank
And we
you.
wish you best of luck in all of your endeavors. And we hope for the universe to bring to life more doctors like you that can help the community, that can
Thank
help the
you.
planet.
And yeah, I want to emphasize that, look, lifestyle medicine is a big tent that we incorporate. Now I know of health coaches that are training who don't have, the master's degrees or the doctorate. So everyone is welcome under the tent to teach, because this is, community member to community member. That's the best part of it.
Wonderful. So there is hope, right, for the
Yes.
humanity.
Well, the hope is that we have to take matters into the community. We can't keep waiting for government and healthcare institutions to make those changes, because they're like the big ships that, take time to change direction. But here we are, members of the community, doing something to better our health. And so just think, the health outcomes related to the physician and the doctor's office when it comes to primary care are relatively on the low scale. It's lifestyle that is the lion's share of their health outcome.
There we go. There we go. Wow. This is amazing insight. Thank you so much for sharing your knowledge and your wisdom.
Thank you.
Thank you, and have a beautiful day.
You too.
Thank
All
you
right.
for
Bye-bye.
joining us.
Thank you.
Bye-bye.
Bye-bye.
We are very happy we got a chance to introduce all these wonderful people to you. And if you have any questions, please do reach out, info@purplesprout.com, or call us, follow us on social media. And of course, write comments under this video, because on our YouTube channel, because it's very important for us to grow our channel, and you can help by sharing this YouTube channel with others, by subscribing to our channel, and by also writing comments that are longer than 8 words. So thank you very much. We are happy to be here for you. We are happy to serve you in this capacity, happy to be able to have an opportunity to bring all this great, practical, wonderful, free content. So thank you. Thank you for your support, and much of love and gratitude. Bye-bye.